Hi guys, my name is April Allen and I am doing a final presentation on Anna Dukin. Anna Dukin worked as a chemist at the Massachusetts Department of Public Health Drug Abuse Lab and admitted to falsifying evidence affecting up to 34,000 cases. In June 2011, an evidence officer at the lab discovered that Anna Dukin had tested 95 samples without properly signing them out. Investigation revealed that she had forged the initials of an evidence officer in her logbook and she was suspended from lab duties. Anna Dukin admitted to altering and faking test results in order to cover up her frequent dry labbing or visual identifying samples without actually testing them. She also admitted to dry labbing for at least 3 years and even went as far as adding cocaine to samples in which no cocaine was present. Here's a picture of Anna Dukin. What is the 6 iOS IEC 17025 accreditation standards that were in non-compliance in the crime lab of Anna Dukin? Management reviews. Reviews its management system at planned intervals in order to ensure its continuing suitability, adequacy, and effectiveness. Preventive actions. All lab members are encouraged to identify opportunities to improve quality and to correct sources of potential nonconformities. Lab safety. It is crucial for employees to follow lab safety rules to protect themselves, others around them, and evidence. Evidence control. The lab has a procedure for transportation, receipt handling, protection, storage, retention, and disposal or return of evidence. Items to protect the integrity of the evidence, the lab, and the customer. Technical records. Records of original observation, derived data, and sufficient information to establish an audit trail. Calibration records, staff records, and a copy of each test report or calibration certificate. Reports and reviews. Data shall be recorded in a way that trends are detectable and statistical techniques shall be applied to review the results. This monitoring should be planned and reviewed. ISO IEC 17025 standard is the international standard for testing and calibration laboratories. It set out requirements for the competence, impartiality, and consistent operation of laboratories, ensuring the accuracy and reliability of their testing and calibration results. General requirements for the competence of testing and calibration laboratories. The laboratory shall use appropriate methods and procedures for all laboratory activities and where appropriate, for evaluation of the measurements, uncertainty, as well as statistical techniques for analysis of data. The content of the international standard covers a number of factors: the qualifications, training, and experience of the staff, the right equipment properly calibrated and maintained, adequate quality assurance procedures, proper sampling practices, appropriate testing procedures, valid test methods, accurate recording and reporting procedures, suitable testing facilities, and traceability of measurements to national standards. Apply how the 6 accreditation standards were breached in the crime lab. Management reviews my first one. According to records, Anna Dukin routinely tested thousands more samples than her colleagues. I believe if management was checking their logbooks when and as they should, they would have caught Dukin's scandal a long time ago. After reviewing the logbook, supervisors would have noticed that her numbers were 3 times more than her colleagues, and they would have also noticed forged signatures. Management was also aware of Dukin's high numbers from other co-workers, but failed to intervene with this information. Lab safety. Dukin admitted to skipping proper procedures and handling the samples. Dukin admitted to taking out samples from the safe and testing these samples without them being signed out as the proper procedure. She also admitted to batching, putting similar samples together, testing some and not the others, also known as dry labbing. She will also put samples next to different samples, causing cross-contamination, for example, putting cocaine next to a sample without cocaine. Evidence control. Dukin admitted going into the evidence logbook and post-dated and filled the logbook in. Dukin also added to a sample that came back from mass spec to make sure it was what it was supposed to be, while also stating that she made some results positive that were actually negative. She also had access to evidence basically whenever she wanted to without doing the proper logbook procedure. Reports and reviews. With Dukin's forged signatures and false logbook information, she clearly did not understand the logic behind reports and reviews. Data was not recorded every time Dukin examined evidence, as well as management not planning these routinely reviews. She had access to evidence that she should not have without reporting it first. Failed reports and reviews cause consequences like this. Preventive actions. Management was very much aware of Dukin's high numbers, and former co-workers tried to inform the supervisors. If supervisors was doing their job and or actually cared about their job, they would have caught many mistakes caused by Dukin. She also had access to evidence basically whenever she wanted to, and she did not store them correctly once she was done with the evidence. I personally believe that Dukin should have received more time than she did, as well as her supervisors, for not catching her wrongful actions. Technical records. Anna Dukin did not follow the rules of technical records. Each test that she conducted was not reported in or reported incorrectly. Information was not sufficient because evidence had been cross-contaminated due to being stored improperly. Cause and effect. Anna Dukin admitted to dry labbing for almost 3 years, tampering with thousands of evidence and improper logins and forged signatures. Once investigations were finished, thousands were released from prison after being wrongfully convicted by the hands of Anna Dukin. She was also incarcerated and sued for millions of dollars, also caused the Hinton lab to shut down. Many preventive measures could have caught her actions at the beginning. It's sad to see how one person could affect so many lives. And here is a picture of the lab that was shut down and the lab that Annie Dukin was working at.